Almost everyone has felt it. A tight, tender knot in a muscle that aches and refers pain somewhere else, and won't release no matter how much you stretch or massage it. Sometimes there's a procedure for exactly that. Welcome to the educational channel of Dr. Ryan Kuda, a board-certified interventional pain physician serving the Chicago area. On this channel, we break down the procedures and the research that shape how pain medicine is actually practiced. Today, trigger point injections, one of the simplest procedures in pain medicine and a good introduction to how this field thinks about muscle pain. Those painful knots have a name: myofascial trigger points. They show up most often in the muscles of the neck, shoulders, and lower back, and they're a common, often overlooked contributor to everyday pain. A trigger point injection is one way to address them directly. A trigger point is a tight band within a muscle that stays contracted and tender, and that can refer pain to other areas, which is part of why it's so confusing to deal with. A trigger point injection is exactly what it sounds like. A thin needle is placed directly into that knot, and a small amount of local anesthetic, sometimes combined with a corticosteroid, is injected. The goal is to interrupt the cycle of muscle tightness and pain so the muscle can relax, and so other treatments, like physical therapy, can work better. This is typically considered when there are clear, palpable trigger points that reproduce your pain, and when they haven't resolved with conservative measures like stretching, massage, heat, or physical therapy alone. It's frequently used as one part of a broader plan rather than a standalone fix. Who is it less likely to help? If the pain is coming from a joint, a disc, or a nerve rather than the muscle itself, injecting the muscle won't address the real source. And trigger points are often a symptom of something else: posture, an underlying joint problem, stress. So the most durable results usually come from pairing the injection with addressing whatever keeps the knots coming back. Let's be straight about the evidence, because trigger point injections are a good example of where honesty matters. The research on them is mixed. Many patients get meaningful, sometimes rapid relief. But well-designed studies have also found that injecting anesthetic isn't always dramatically better than the effect of skilled needling alone, and that the benefit is often short to medium term rather than permanent. What that means in practice isn't "don't bother." It means the realistic frame is a tool that can break a pain cycle and create a window where stretching, strengthening, and addressing the underlying driver become possible. Used that way, as part of a plan, it can be genuinely valuable. Used as a standalone repeat fix without addressing the cause, it tends to disappoint. For pain that's truly stubborn and resistant, there are escalation options, including, in select cases, botulinum toxin. But those are specific decisions for specific situations, made with a physician. The procedure is quick and usually done right in the office. The physician first locates the trigger points by feel, pressing along the muscle to find the taut, tender bands that reproduce your pain. In some cases, ultrasound is used to guide the needle, especially for deeper muscles. The skin is cleaned, and a thin needle is placed into the knot. You may feel a brief twitch of the muscle, which can actually be a sign the right spot was hit. Each point takes only moments, and several can be treated in one visit. There's no sedation and no real downtime. Most people drive themselves home and return to their day. Because it's so low disruption, it's often one of the first interventional steps tried for muscle-driven pain, and easily combined with the rest of a treatment plan. Recovery is usually minimal. It's common to feel sore at the injection sites for a day or two. Sometimes the treated muscle feels a bit bruised, and then to notice the underlying tightness easing. As with any injection, there are risks, and which ones are relevant depends on the muscle being treated and your own health. That's a conversation for a physician who has examined you. The honest appeal of trigger point injections is their simplicity, low disruption, quick, and easy to combine with therapy. The honest limitation is that they work best when they're part of a plan that addresses why the knots formed in the first place. Bottom line, trigger point injections target the tight, painful knots in muscle directly, and for many people they offer real relief. But they tend to work best as one piece of a larger plan, not a permanent standalone fix. If you're considering one, a useful question is, what's the plan for keeping these trigger points from coming back once the injection helps? A reminder before we wrap. This is educational content, not medical advice. Talk to your own doctor about your specific situation. If you found this useful, subscribe. We break down pain procedures the same way every episode. What they are, who they help, and what the evidence really shows.